means we've all mastered the mute and unmute.
I think that was our when we had our maiden voyage. I think that was the problem. Do you think?
I think so.
Yeah. You live and learn. Great story for sound check. They're making great story for sound checks. Well, we're at 12:01, Chuck. You want me to go ahead and get started?
I think so. You have mayors and senators and chairs and council members all online. So I think we're ready to go.
Great job. Well, it's great to hear that we're ready to roll. It's 12:01. Good afternoon, everyone. This is your COG Board Chair, Derek Leon Davis. I'd like to call the June COG Board meeting to order. Thank you all for joining us virtually for today's meeting. Recognizing that this is a virtual platform, we request your patience with any glitches that may arise. Please make sure your microphones are muted. Please make sure your microphones are muted. If you would like to speak, please make sure to unmute your line and then return to mute after speaking. Please make sure that if you speak, unmute your mic, then mute your mic after you are completed. First, I would like to lead us in the Pledge of Allegiance, and then I will cover some of the virtual meeting logistics. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all. Thank you all. Okay, now on with today's meeting. Being able to see each other all will pose some challenges for me to facilitate discussions and voting. So staff has worked out an arrangement. Let me outline the process as planned. After my initial remarks, Sharon Pandick will take a roll call of members or alternates to document your presence at today's meeting. When you speak, please remember to state your name and jurisdiction. Instead of our usual audio only stream for media and public, our webinar audio and video are being live streamed on the COG website through COG's YouTube account. To facilitate questions and comments for our speakers as smoothly as possible during the meeting, staff have provided two options. The first is to write in the WebEx chat function your name and that you have a question. First option is you write your name and your question in the WebEx chat function. After I facilitate those questions, I will verbally call any questions from each state. During votes, after a motion to adopt the resolution is made and properly seconded, we will proceed to discussion. After discussion, I'll first ask for abstentions and nay votes. So the first thing will be abstentions and nay votes. I ask that you state your name and jurisdiction as you state your vote. The rest I will take as a yes vote. The only ones that need to state specifically are abstentions and nays. The rest I will take as yes votes. A reminder to read along via the electronic board packet with the link sent out to you by email and posted on the COG website. Okay, if you have an IT question during the meeting, please email Pat Warren. IT questions, email Pat. Are there any questions from board members from Maryland? Any questions from board members in Virginia? Any questions from board members from the District of Columbia? Hearing none. Sharon, please proceed with today's roll for today's meeting.
Thank you, Mr. Chairman. It looks like you have a full house. I have from Maryland, Mr. O'Connor, Mr. Dennis, Mr. Moe, Mr. Jordan, Mr. Hucker, Ms. Navarro, Mr. Riddick, yourself, Mr. Davis, Ms. Newton, Ms. Stewart, and Mr. Feldman. Am I missing anyone? From Maryland. Okay, from Virginia, I have Mr. Wilson, Mr. Dorsey, Ms. Gross, Mr. Snyder, Ms. Banks, Ms. Randall, Mr. Wolf, Mr. Sendejas, Ms. Wheeler, and Mr. Parker. Am I missing anybody from Virginia?
Did you get Barker?
I did. Thank you, sir.
Okay, thank you, thank you.
And Ms. Banks is an alternative for Supervisor Julie Briskman.
That's correct, and she is not here yet, so you're properly seated. And then anyone else from Virginia? And then from the district, I have Mr. White. Am I missing anyone from the district? Ms. Perry?
Yes.
Thank you. Mr. Chairman, you have a quorum.
Thank you very much.
Mr. Chairman,
Please.
I apologize. This is Rodney Lusk. I just joined the call. I'm actually on the call as opposed to the video conference.
All right. Thank you, Rodney. Full house. Did you get that, Ms. Bandit?
Yes, sir, I have a full house and Mr. Lusk.
Perfect. I'll proceed with the chairman's report. On June 1st, I joined with my vice chairs to issue a public statement through COG, the tragic death of George Floyd, as well as the many other unarmed Black Americans who have died at the hands of law enforcement. The three of us took the prerogative as your board executive committee to swiftly join what became a chorus of voices last week calling for systemic change. I know that many of you here around our virtual table issued similar calls, highlighting the important role that local government can play in correcting injustices, inequalities, and healing our communities. And it has been heartening to see so many private sector and community partners pledge their support. These statements of solidarity have been incredibly powerful. Now, of course, we will all be judged by our actions and how we rise together to meet this moment. Today, I have a few colleagues who I've talked with, and I'm going to allow them about a minute just to give a brief remarks and reflections on the similar events that have transpired throughout our district. I'll call on Ms. Stewart from Tacoma Park, Navarro from Montgomery County, and Mr. Lusk from Fairfax. Let me start with Ms. Stewart. Mayor Stewart.
Thank you very much. Thank you, Chair Davis, for calling on me to speak. However, I believe at this time it is my job and my job of my white colleagues here in this virtual room and in positions of power across our country to listen and to support Black and Brown residents, colleagues, and friends. I urge other white people to use this moment to critically examine our role in structural racism and to take decisive action that is being called for and led by Black activists and community leaders. We cannot ignore or diminish the pain and oppression of the last 401 years. Thank you.
Thank you, Mayor Stewart, for those words. Ms. Navarro.
Thank you, Mr. Chairman. These are challenging and inspirational times. Many thanks to the hundreds of thousands of people of conscience who have seen the brutal murder of Mr. Floyd as an opportunity to confront systemic and institutional racism. They have given an urgency to the demand that Black lives matter. Mr. Floyd's death will not be in vain. We in Montgomery County have had our own share of instances of excessive use of force by police and widely publicized deaths as a result of police action. Emmanuel Okutuga, Robert White, and just last month, Finan Berhe. This is not acceptable. As leaders, we owe our residents a warm and welcoming place in which they feel respected and safe. We are making changes. Our council has begun to invest in systemic efforts to reform the way we conduct the business of work and life in Montgomery County. In November 2019, the Racial Equity and Social Justice Law, which I authored, was born. Under that umbrella, we have seen several laws and initiatives like community policing, focused on confronting racism and bigotry in general, and in particular, police brutality in our county. This law is groundbreaking and is being proposed, for instance, in the legislative houses in the state of New York. We will be doing more in the next several weeks to ensure that our police department is trusted and accountable to our residents. As a proud Latina and mother of two fierce Afro-Latina young women, I stand with my Black brothers and sisters. Thank you.
Thank you so much, Councilmember Navarro. Supervisor Lusk.
Thank you, Mr. Chairman. I'll note that the Board of Supervisors at its meeting yesterday adopted a statement, and I'll note several parts of it. So most clearly, we want to state that Black Lives Matter. Mr. Floyd's violent and wrongful death at the hands of the Minneapolis police has been the tipping point that has prompted thousands in our region to stand up against persistent racial inequality in our country. Locally, as many of you probably have seen, we have some work to do here in Fairfax. Unfortunately, last week, one of our officers violated not only the Fairfax County Police Department policy, but has broke the trust with our community that has been placed in us to do our jobs properly. We recognize that we have officers who are committed to their work and are passionate about their work, and we know that many of them are in anger at the events that were witnessed here in that particular incident. And we'll also say that we've got to do a lot to establish better commitment and to strengthen the community's trust. What I will say is that the Board of Supervisors is demanding transparency and accountability in our local government, and we're going to have to do a number of things. We're going to have some very needed and difficult conversations, listening to the concerns in the community, and then re-examining our policies and making sure that we are able to listen and to heal together as a broader community. So in order for us to do that, we, at the Board of Supervisors meeting, established a Chairman's Task Force on Equity and Opportunity, which will be focused on advancing racial equity and promoting change necessary for creating a Fairfax County that works for everyone, creating a Fairfax County that works for everyone. So we will be, continuing to work on this, and I'll say that I was very proud by the swift action that the police chief and the Commonwealth Attorney took once this incident became public, and certainly the body-worn camera was pivotal in this. So for all of us who do the work that we do here as locally elected officials, we see the importance of that body-worn camera being deployed throughout our police force. Luckily, in this case, that department and that officer had the camera. We will be looking to deploy cameras in 2 more phases so we can get all of our policemen equipped with those, because we recognize that that is really the best way to ensure we have transparency in the dealings with our law enforcement and members of our community. So with that, I'll say stay tuned. We've got some healing to do here in the county and also in the nation. Thank you.
Thank you, Supervisor Lusk. Thank you, Councilmember Navarro. Thank you, Mayor Stewart. I'll just say very briefly, and all of my colleagues have hit on it. This region has come together for many things. I'm just so proud of this region as we've witnessed peaceful protests, as we've witnessed the quelling of people who wanted to participate in riotous behavior. I'm proud of how we show up in a nation that needs us. Rodney just mentioned the body-worn cameras. I had a conversation yesterday talking about in Prince George's County how community policing has been a part of our culture for the last 2 to 3 decades. And I had a statement with my police chief where, I just had to express how proud I was of our force. Although we've had some missteps, and we're going to have missteps. Ultimately, and I'll say it, and I mean it the way I say it, that all lives matter when all lives matter. All lives matter when all lives matter. And so I'm proud of this region, and even the steps that we're going to take today and the things that we have to discuss. We'll be able to talk later in the agenda about health inequities, which is also something that we have to tackle together. Move on. This is a little sadder topic that's kind of a segue from the reality of us dealing with the coronavirus. It saddens me to say that we will not be having our annual Board of Directors retreat this year at Chesapeake. Hurts me from the perspective of being a Marylander. I love to get you guys across the bridge for crab cakes and all of that rich discussion. But we understand that our region is gradually reopening, and we still need to take the necessary precautions to show leadership in keeping everyone safe. As a result, we will be having 2 additional meetings this year. That's where everyone cheers, I think. Oh, your mics are muted. My fault. July 8th and August 12th. So what we hope to do is cover topics during those 2 meetings that have been featured for our retreat, but also topics that are germane to the times that we're dealing with. So next year's board retreat will be held on July 23rd and 24th, 2021. You can find this information on page 5 of your board packet. And so now let me move on to item number 3, just about 10 minutes behind schedule. I apologize. Let me turn it over to Mr. Bean for updates and the executive director's report. Mr. Bean.
Thank you. While Jenny brings that up, nice segue, Mr. Chairman, from items at the retreat to items that we'll have in July, August, September. Next slide, please. Upcoming for the board are 3 initiatives at the nexus of land use and transportation. These are all coming before the Transportation Planning Board, but because they all have either a strategic land use component or economic development impact, these merit consideration by the COG Board. So the first is the MARC VRE rail run-through study. A market feasibility study was recently completed and briefed out to the TPB last month. The broader vision is that neither MARC nor VRE would dead end at Union Station, but could run through, thus enabling 1-seat rides from Frederick to Crystal City, and vice versa. The long-term vision is that this would evolve from what we now call commuter rail to regional rail. And if desired, the COG Board could be briefed on this. Next, the bicycle-related National Capital Trails Network has been years in the making. Originally scheduled to come before the COG Board in April, this would come before the COG Board in August for your consideration and endorsement. 1,400 miles of trails are envisioned in this network, and this network would connect 118 of the 140 activity centers. And while off-road trails are the purview of local jurisdictions, the shared vision of a regional trails network would enhance quality of life by greater access to amenities and greater connectivity, particularly between and within activity centers. And next, part of the ongoing work related to activity centers, the TPB will be briefed on what we call transit access focus areas. Essentially, these are plans to optimize access around high-capacity stations in the region. And though it leads with the word transit, in my view, it is also a land use analysis and thus merits a brief out to the COG Board.
I thought he was.
And, next up, we have also an environment issue. COG's Climate, Energy, and Environment Policy Committee continues its work to analyze and develop 2030 goals for greenhouse gas emission reductions in the region. 2030 goals have not been set, but this will come to the COG Board in early fall for consideration and adoption. We also expect to bring back the Election Officials Committee in August to brief out on lessons learned in the past few months and a look ahead to the conduct and security of the November elections. And next, one item to note, as part of a coalition with several other organizations, COG is co-sponsoring a rather large Zoom event tomorrow at 12 noon. Speakers include staff from 5 COG member jurisdictions, District, Prince George's, Fairfax, Alexandria, and Montgomery. And I'm aware that there's an appetite expressed among you to learn from each other. I note that Chairman McKay, Vice Chair Gross, Supervisor Lusk have touched on this creation this week of a task force on equity and opportunity in Fairfax County. One of the speakers for this event tomorrow is the Chief Equity Officer. Essentially, this position was created by Mayor Wilson and the Council in Alexandria in the last year. And Montgomery County, we have the Chief Equity Officer, and would note, reinforce, Councilmember Navarro was the author of Montgomery County's racial and social justice legislation. So I think your comments offline after this meeting to the COG Executive Committee about how you would like to engage in a learning community, learn practices from each other, structures, policies, and we'll look to take that up. Mr. Chairman, happy to answer questions about our work, about the co-occurring crises in the region. I'm aware that these are being addressed today by health officers and elected officials in items further along in this board agenda. Thank you.
Thank you, Mr. Dean. Appreciate that report. Let me continue to amendments for the agenda. Are there any amendments for the agenda? Hearing none, I'll move on to the next item. The next item is the approval of minutes from May 13, 2020. Is there a motion and a second to approve?
Opposed, Fairfax County, move to approve.
There's a motion by, sound like Ms. Gross.
Supervisor Bailey from Prince William County, second.
Very much. Let me turn to board members to see if there are any abstentions or nay votes. Hearing none, the motion passes. Thank you. Agenda item number 6 is the consent agenda. We have one resolution on the consent agenda today, Resolution 22-2020, authorizing COG to procure and enter a contract with the Occoquan Watershed Monitoring Laboratory to research freshwater salinization syndrome in the metropolitan Washington region. Is there a motion and a second to approve the consent agenda item?
Gross, Fairfax County.
There's a motion. Is there a second?
Bailey, Prince William County, second.
Thank you. Are there any nay or abstentions? Nay votes or abstentions? Hearing none, passes. Agenda item number 7. For our next item, the board will be briefed on the results of the point-in-time count of persons experiencing homelessness in our region, which is completed by COG's Homeless Services Committee. We will hear from co-chairs of the committee, Montgomery County Homeless Services Administrator Kim Ball and Prince William County Homeless Services Division Chief Tony Turnage. Let me turn first to Ms. Ball. Ms. Ball, can you unmute?
Good afternoon.
Excellent.
Can you hear me okay?
We can hear you now.
Okay, great. Thank you for welcoming us to the board meeting. We're very happy to present the results today. I'm going to actually turn it over to my co-chair, Mr. Turnage. He'll be presenting on the first few slides, and then I will take it back over.
Thank you. Mr. Turnage, are you unmuted?
Yes, I am, sir. Good morning. Good afternoon to you, rather. So I have a brief introduction, and then I'll get right into the slides that Ms. Ball just talked about. So good afternoon, COG Board of Directors. On behalf of the Homeless Services Committee, thank you for the opportunity to present the results of the 20th annual point-in-time count of the region's homeless, which is conducted on January 22nd, 2020. I would also like to thank the non-participating jurisdictions for their cooperation and support in providing the data for today's presentation. And I would also like to thank the COG staff, especially a special shout out to Hillary for the work that she has done on behalf of this as well. The 2020 point-in-time enumeration was the one-day annual snapshot of the number of sheltered and unsheltered persons who experience homelessness in the region. The count included literally homeless single adults, families with children and unaccompanied youth living in the shelters, transitional housing, on the streets, parks, and campsites, and as well as accounted the formerly homeless individuals in permanent supportive housing, those who were rapidly rehoused, and those living in other forms of permanent housing. The count does not include persons who are at risk of becoming homeless due to evictions or living in doubled up and tripled up situations. All jurisdictions do increase their shelter capacity during the winter months to encourage people who might otherwise sleep on the streets to go to the local shelters in order to prevent loss of life. A couple additional points that we will add is at the time that the count took place, the global pandemic caused by COVID-19 was not evident in the metropolitan Washington area. However, COVID did not impact the methodology or results of the 2020 enumeration. However, the context in which we are sharing these results has dramatically changed. Now more than ever, the public health crisis demonstrates that housing is healthcare. If you can advance to the first slide for me, please. This first table here shows is a comparison of the literally homeless count by jurisdiction from 2019 and 2020. In 2020, 9,763 persons were counted compared to 9,794 persons in 2019. This represents the lowest number ever recorded since the region began collaborating on the count in 2001. And the second year in a row, the total number of persons counted was below 10,000. This represents a small 31-person decrease compared to last year. Next slide, please. The household composition table is a breakdown of the number of single adults, households with children, families, the number of persons in households with adults and children, and the number of households with only minor children. That's 2016 to 2020. Since 2016, the region has had a 42% decrease in the total number of persons in family compared to a 4% increase in single adults. For 2020, the region had the fourth consecutive year of decline in the number of persons in homeless families. Children also represented 59% of all persons who were homeless in families in the count, and nearly 1/3 of the region's literally homeless population are children. Next slide, please. This slide, despite being employed, many family heads of household and single adults cannot find housing they can afford in the region. 36% of adults and families in the region self-reported that they were employed either full-time or part-time. The highest levels of employment were reported by Loudoun County with 95% and Prince William County with 69%. 36% of the homeless single adults in the region self-reported their primary source of income was from employment. And now I will turn it over to my colleague, Ms. Kim Ball, to take it from this point forward.
Good afternoon again, and thank you. As Tony did state, I just want to re-emphasize the importance of the collaboration that we have during this enumeration count. It was, again, a very successful count during this pre-COVID time. So the beginning slide is the ending veteran homelessness. And we did have a slight increase in our numbers this year. It's very slight. It is approximately 3 veterans. During this time, we have noticed, unfortunately, after COVID, we've had difficulties getting our veterans housed, even utilizing our veteran services in terms of moving people from veteran hospitals or hospitals to veteran services. In addition, many of the veteran programs, such as the one in Hartford County and in Virginia, are no longer accepting admissions during COVID. So this has also become a challenge. We are utilizing rapid rehousing funds that have been provided to make sure that we keep our numbers of veterans down in the community. Slide. So this slide represents our single adults in the metropolitan area. With utilizing the definition of chronically homeless defined by COG. Basically, of course, that means a person that has been homeless for 12 consecutive months or 4 episodes of homelessness in the last 3 years. They also must have a disabling condition. Since 2016, the region has reduced the incidence of chronic homelessness by 13%, which is a huge number. In Montgomery County, we've been able to reduced this by 93%, which was led by our focus on ending chronic homelessness beginning in 2018. We had our largest numbers with housing over 415 chronic homeless adults since 2016. This is also due to funding from our county council, county executive, and HUD. We are utilizing our by name list, as many jurisdictions have begun to do so. And with the housing first approach, we are able to utilize these strategies to continue to reduce the numbers of chronically homeless and those that are most vulnerable in our system. Next slide, please. So moving forward, definitely now during this time, housing is healthcare, especially after COVID. We want to focus our operations on moving the most vulnerably, medically, and elderly out of our homeless situations. The county 9 jurisdictions have met continuously during this time and talked about our strategies to utilize to move our families out of and individuals out of homelessness. Most of us have utilized hotels, recreation centers, and the federal and state funding, which has allowed us to increase our permanent supportive and our rapid rehousing dollars. Rental assistance has been utilized in terms of prevention funds for clients to not come into our homeless system. The importance of permanent housing at this time cannot be emphasized enough. During this pandemic, without a home, it is essentially changing and challenging the ability to stay healthy and safe. Given the dramatic rise of unemployment, we are in fear, as many jurisdictions I'm sure are, that this will be an ongoing and very challenging next year, as many families and individuals may experience homelessness due to COVID-19 and unemployment. And perhaps the most important, I really appreciated the introduction today led by the chair in response to the racial equity. As most people have already identified, this is a challenging time for our people of color. The response to the pandemic has been centered on also the racial inequity. People of color are disproportionately represented in our homeless system and disproportionately represented in COVID-19 infections and in death. So our continued response to this as a region is most important. Tony, would you like to add any other information regarding housing and healthcare?
No, not at this time. I probably guess I would say we can open it up if there are any specific questions from members of the board here.
Thank you, both Ms. Ball and Mr. Turnage. And we also have our staff on questions if necessary, Mr. Desjardins, as well as Ms. Chapman. So let me see. I don't see any questions in the chat function. Let me turn to Chuck and our IT folks to see if we fielded any questions any other way.
Okay, is there any way can I present a question?
Absolutely. Is that Mr. Collins from Charles County?
Yes, it is. Charles County.
Mr. Collins, you have jumped to the front of the line.
And, and thank you. And the discussion on homelessness in this very particular time has been associated with the whole concept of defunding police departments. And so I was curious to, to hear any comments about that very specific issue. Because, we've very recently approved our 2021 budget. And so what I'd certainly like to be apprised on is if there's any very specific discussion on addressing funding that could possibly be redistributed from, actual law enforcement to dealing with homelessness, and whether there's any actual thinking on how that could be appropriately done.
Thank you, Mr. Collins. Not sure if we're addressing that specific question too, but I will say that from the perspective of some of the committees that we have established with regard to COG, and since that is a issue that has become part of the lexicon more recently, even if it was a part of the lexicon prior, it's become more pronounced. Something that we need to talk about. The first thing is, I'm not even sure what defunding police yet, what it specifically means. That we need to possibly consider what that means. And we haven't had a significant discussion in my jurisdiction with regard to the concept of defunding police. But I can say over the past, as I said in my opening, over the past several decades, we've been focused on community policing, focused on our police becoming a part of the fabric of the health realities, of mental health realities. They're part of our force that we use in conjunction with the sheriff's department when we deal with domestic violence issues. Their relationship with our Department of Social Services, Family Services, and Health Services, to me, has been a stellar partnership. So as we deal with this new idea and this new concept, we should begin to study. Chuck, I see you rustling. Is something that you might have had conversation with some of our committees that add to this?
I think the appropriate venue, because this is a policy question, would probably be the Human Services Policy Committee. That is chaired this year by Brandon Doe from the district, and there is a focus on homeless services. So either Mr. Collins or another representative from Charles County, that probably would be the appropriate venue to engage on that.
Right.
And I want to be respectful to both of you, because obviously this is a very immediate issue.
Yep.
And so, I mean, the way I look at COG is it's actually a part of, the wealth of, knowledge and experience to kind of address these issues. So I'm not trying to be disrespectful. I just saw an opportunity to kind of take advantage of the expertise that was here, and I will follow, procedure, but I want you to understand where I'm coming from.
Ruben,
I want you to just understand where I'm coming from.
It's ultimately timely. It is today. I think that it's on all of our hearts and minds to understand how we process, the new information or the realities that we're facing in the most collaborative way, and take advantage of this moment. So we appreciate that, and definitely something for us to consider.
No, that's where I'm coming from.
Not a problem. I'm looking on the chat line. Looks like, is it Miss Gross who has a question or comment next? Miss.
Thank you, Mr. Chairman. Yes, I do.
Thank you, Ms. Gross, please.
One of the things that I think is going to be coming up that we all need to be aware of, and probably are all aware of, is at least in Virginia, as a result of COVID-19, the governor has postponed all evictions. When our jurisdictions get back to more of a normal speed, those evictions will most likely start being processed. And so we may have, as a result of COVID-19, more people seeking shelter because they have lost their homes, their apartments, especially because of rents. So I know part of the CARES Act was to assist nonprofits who can assist people with their rents, but that's only a finite amount of time. So I just sort of on the putting out there for something for us to be aware of in the future. I think as these evictions may start taking place, we're going to see more people, families especially, seeking assistance from their local governments. That needs to be part of the discussion. Those are not chronically homeless people. They are people who are going to be displaced because of loss of jobs due to
Right.
COVID-19. Thank you.
Thank you. Ms.
And
Gross.
Chair Rendo, Mr. Chairman.
Thank you. I'm looking on the chat now. I see Chair Randall. You had a question or a comment?
I do. Thank you, Mr. Chairman. Can you guys hear me fine?
Yep.
All right.
Yeah.
So two things. To Ms. Gross's statement, I would tell you in Loudoun County, we have focused a lot of our CARES Act money on rental assistance. We even put a pot of money aside that was specifically for people who had non-conforming leases. So if you are renting a room inside of someone's house, that's a non-conforming lease, because the CARES Act money didn't allow, some of the CARES Act money didn't allow for that. So we put that money aside. And so depending on what you have put toward rental assistance, we would hope that the COVID-19 would not increase the number of homeless, the homeless population. Although, as Ms. Gross said, it's certainly possible. I do have a question, though. It is my understanding, and I just want to make sure this is correct, that when doing the point in time count, that every county is doing it, or every jurisdiction is doing it the same. And so if someone is couch surfing, they're not counted that night because they might actually be in a home that night. So as we're looking at these numbers, is every jurisdiction using the same guidelines and criteria to do their point in time study? Because if you're not, and if they're not, then your numbers could be skewed. So I just want to say that. Thank you.
Thank you. Thank you, Chair Randall.
So if you had a question, this is Tony Turners from Prince William County. We meet as the Homeless Service Committee to make sure that we're clear about, one, what is HUD requesting us to actually capture and see if there are any changes. And then we also talk regionally about making sure that we're all on the same page. Now, sometimes jurisdictions may do some additional questions, but we all agree that we all have the same questions to make sure that it's covering the HUD questions and all regional questions that we have across the board. So everybody should be utilizing the same definitions and things of that nature in order to determine who they count. So Ms. Randall, to your question, we do not count persons who are doubled up as a part of the homeless count.
Thank you, Mr. Turnage. See, one last question. Just want to check in with my good friend, Mr. Diaz, to see if he wanted to pose his question that he put on the chat about local governments addressing rent increases due to gentrification. I think he's talking specifically, in parens, about Amazon HQ2, says that most people affected are POC citizens. Mrs. Zendejas, you want to expand?
Yes, so can you hear me?
Yes. Yep.
So with what's going on with our country, we talk about Black Lives Matter in response to police brutality, but also there are systemic issues that affect other organizations, including local government, state level, and federal level. And one of the biggest things that has affected our country's history is housing, with the redlining and everything else like that. And sadly, it does affect mostly people of color. And my thing about us making progress to have equity in our region, to make sure that our community is going to be taken care of. Also understand that we do have labor trafficking issues in our region, exploitation of people of color. So we need to ensure that if corporations are coming to our area and they have these statements all the time about, oh, we're gonna respect people of color, Black folks, they need to also take action. And for me, the fact that I've seen cases where people have lived in the apartments for many years, but then they get hiked with the rent for $200 per month extra, that is what I consider unfair and also discrimination, because these people are not able to pay their rent. And that also has to do with, with wages. We don't have living wages for people to succeed, to have savings, to make sure that their families are stable. The fact that people are living in poverty is not with only the finances, but also the mental health component. A lot of people are stressed out and we need to make sure that our citizens, our people that live in our community, are well respected. It's not only about making a statement, but taking action. Thank you.
Thank you, Hector. Appreciate that comment. I think what we'll do is take that under advisement and make sure that we add that as part of what we discuss in the committee as well. I think that's something that's important to note. So I said that was the last question, and probably should have been the first question, just looking at trying to follow the chat. And I think I missed it, so I apologize to Hector as well. So let me close out so that we can stay on.
Mr. Chairman, this is Nancy Navarro.
Please, Nancy, go ahead and make that comment, and let me make that one the last comment. I'm looking up and down trying to follow it. Thank you.
Thank you. I just want to react to the comments that have been made and identify that there is a thread. And I think that it is very important and perhaps timely for COG as the board, perhaps to have a conversation about the issue of racial equity and social justice as an umbrella that can, I think, guide our work as local governments. And so I would just like to recommend a request that we actually schedule an item to discuss this. I would be happy to share what we're doing in Montgomery County, but the comments that have been made will have that one thread. The issue of racial equity and social justice is not just about police issues. It just cuts across all of the issues that we're just discussing. And, how do we manage our budgets? How do we take into consideration these issues of land use and access to housing, transportation, healthcare? It just cuts across everything. So just want to make that request of you, Mr. Chairman, if it's possible to perhaps fit into one of our upcoming meetings, an entire item on racial equity, social justice in local government.
Thank you. You foreshadow. I believe one of our discussions in executive committee was just that. So I'll turn to Mr. Bean. I can't see him smiling yet, but I'm certain he is.
Yes, sir. We'll make that happen.
Perfect. So as I stated, and I appreciate everyone, and bear with me as I try to follow your comments on this chat box with these old eyes of mine. But let us move on to the next item in the essence of time and timeliness, trying to stay on schedule for the agenda. Next, we'll have agenda item 8, which is health equity. How opportunities for health are shaped by race and ethnicity. The board will receive an overview of a health equity brief produced by the VCU Center on Society and Health for the COG Health Officials Committee. You can turn to page 25 in your board packet, and you'll find the briefing materials. Today we have with us, I know currently on our virtual platform, Dr. Ruben Voorhees, the Arlington County Public Health Director, and Dr. Stephen Wolf from the Virginia Commonwealth University Center on Society and Health. We also expect to be joined possibly by Dr. Travis Gales, our Montgomery County Health Officer. But let me turn this over to Dr. Wolf.
Thank you. And I want to thank Councilwoman Navarro for providing a great segue into this topic. On your screen is a report that we did for COG 2 years ago. Uneven Opportunities was a report that looked at how not only our health varies across the COG region, but the conditions that shape health. So if you'll go to the next slide, Jenny, what we showed, for example, is that life expectancy varies by 27 years across the region. We developed an index that is mapped on the left showing how greatly the conditions for health vary across those areas. If you go to the next slide, Jenny, we talked in the report and in other work we've done for COG about the factors that shape health, and the circles in the middle are the familiar social determinants of health that people in public health often mention. But you'll see on the left that we also called out race and ethnicity as an important factor. The Health Officials Committee, which was responsible for leading our work, set aside an idea of actually developing a follow-up document to focus specifically on the issue of race and ethnicity. So this is presaged a year or so ago. And what we wanted to talk about today is we've completed that. I wanted to sort of first give you a quick overview of what's in it, and then talk about the implications. Next slide, please. So this is what it looks like. It's a one-pager, but we're showing you both sides of the one-pager. And I want to emphasize again, this was largely written before COVID, before George Floyd, obviously, and lays out some basic, quick concepts. Obviously, hard to cover something that's complicated in the space in front of you. But we also commissioned the illustration by the Black artist Alexandra Bowman to try to convey visually the message we're trying to portray. The image on the left is the situation we currently live in which there is a social divide, and the image to the right is portraying a more inclusive future where opportunities not only for health but for economic opportunity and social mobility are shared in an inclusive way. Next slide. I'll just, and you can't read that fine print, but the actual brief is available to you now. But here are the main talking points that are covered by the brief. First of all, it briefly explains that health varies greatly across the COG region, as I just mentioned. We did bring COVID-19 into the final draft of it because it had already erupted as we were going to final copy. And we basically presented as a harsh current example of an old problem. We talk about how health outcomes vary widely by race and ethnicity. We go into some detail about how health is shaped by race and specifically by structural racism. A statistic that was in the original report that we did for COG in 2018 is called out more specifically at the request of the Health Officials Committee, which is that nearly half of the variation in health that we see across the region is associated with race and immigrant status, which is a pretty striking statistic. In the graphic that I showed you earlier, this is actually painted on the wall of the visual on the front page. We talk about how inequities are products of policies, past and present, and we talk about what some of those past policies were and how many of those inequities are perpetuated by today's policies. We talk about the biology of how discrimination affects our health through different different biologic pathways. And then finally, we close with a upbeat note about how jurisdictions across the COG region have committed themselves to addressing inequities. And again, this was all written before the current events. Next slide. As I said, Jenny, could you advance it to the last slide? As I said, the COVID pandemic emerged just as we were going to final copy on this, and we did work that in. But now, with the events of the past 2 weeks, it seems even more timely to be coming out with something like this. So I'll leave it at that, and I think Dr. Varghese wanted to make some comments after this.
Thank you, Dr. Wolf. Thank you, COG Board, for allowing us to come and present. I represent Arlington County, and this issue that Dr. Wolf has talked about, comes as no surprise to the health officials in the area, and I think to none of you on this call. But just looking at it from an Arlington perspective, when we looked at this data just a few years ago, while there's a 27-year difference in the COG region, for a jurisdiction as small as Arlington with 26 square miles, we have a decade of difference in a 1 mile distance. Can you imagine that between one census tract to another, there's a decade of difference in just a mile area? So that's a problem. So, and they're saying I don't know why my screen isn't showing up, but my apologies, and I hope you can hear me. That's an unusual, that's a very disturbing thing to have to think about. And I think a lot of people have forgotten that what we entered into COVID are the conditions that were pre-existing. So I think a number of people are kind of horrified suddenly realizing that the pandemic of COVID and the pandemic of racism are suddenly colliding, and it's a surprise. And I had to remind people in the community that we knew where the areas where there was disproportionate impacts of COVID, and I didn't need data necessarily to prove it. The data has subsequently borne it out, but the zip codes and census tracts where we have the predominant number of racial minorities and low-income individuals are the places where we're seeing more cases of COVID, and they're the individuals who cannot stay at home. They're the ones who actually have are essential workers in so many ways, and they have to go out and get exposed, and they're exposing each other. And we as a county are trying, at least in the COVID response, to provide the support to help reduce that impact. But that is still a small component of a larger problem. This is a systemic problem, not unique to Arlington, not unique to our region. However, you can only control the parameters we have. It's very good that we're talking about this, and hopefully we can use it on actual action and change the policies that lead to these systemic issues. I will leave it at that, and I believe Dr. Gales is joining us.
Good afternoon. This is Travis Gales from Montgomery County. Thank you, Dr. Wolf, and to your team for being patient and working with the health officers as we have gone back and discussed this over the last 2 years. And to Dr. Varghese' comments, represent what, large part of that discussion. I think what's really challenging for us in this region, and the report is so valuable, is that when we look at other jurisdictions across the country, in many ways, I think we have a false sense of security. We say, well, we don't have extreme examples of this happening or that happening. And, we may feel that we are immune to these types of things. But I think this report calls out that even in our, what some would argue as progressive jurisdictions, we still see racism and the impact of bias impacting our health outcomes and impacting the policies that we have in place significantly. And it is a call to action that we are not immune to being impacted by some of the very same things and types of systematic factors that have driven more extreme examples in other areas. And so it introduces the opportunity to begin to look very critically at how we view race and how we look at the impact of race on the policies that are put into place, not only from health organization standpoint, but also a call to action for agencies and organizations that do other things, and thinking more critically and thoughtfully about how their respective policies have an impact on health outcomes. So we are excited to have this work. We're excited to have it in a one-page format that pushes the conversation. And from the health officer perspective, we have been excited to have the one-pager to be able to share with our elected officials to be able to drive and guide those conversations that you all have in your respective areas. And I will say one other thing that we as the health officers recognized in reading the report was that we have a long way to go ourselves. And so we have to do important work. And to that end, last year, it's been derailed a little bit with COVID-19, but we are getting back to it. We actually contracted with GARE to do some work and workshopping within our panel. So each of our monthly meetings includes an hour-long training session with GARE to talk about how we can improve racial equity work within the health context, but also be able to communicate our message more effectively with the community, our messages more effectively with our elected officials, and ultimately drive not only talk about the work that needs to be done, but be effective change agents in that process.
So I think Chairman Davis could entertain questions from the board to the health officers, Dr. Gales or Dr. Varghese, or to Dr. Wolf from VCU.
Colleagues, any questions? Let me check Since I see none lit, let me ask from the perspective of jurisdictions, are there any additional questions from board members in Maryland? Hearing none, are there any questions from board members in Virginia? Hearing none, are there any questions from board members in the District of Columbia? Hearing no questions. Thank you, doctors, for joining us and sharing your expertise. This is very timely, as noted by the fact that you had to take the issue of the day and add it to the report at the very end. We appreciate you all and all the work you've been doing, whether it be for COVID or for racial equity and bias in our region and across this country. Appreciate y'all. I'm going to go on to agenda item number 9. And this is with regard to reopening. It's clear that our collective action in the metropolitan Washington area to physically distance has had a major impact in slowing the spread of COVID-19 and have allowed our jurisdictions to begin phased reopenings. Today, we will hear from Montgomery County Executive Mark Elrich and Loudoun County Board Supervisor Chair Phyllis Randall on their jurisdiction's initial reopening experiences and the importance of continued coordination. After we hear from the officials, I'll facilitate some more Q&A and maybe some discussion. Let me start with Board of Supervisors Chair Randall on this piece.
Thank you, Chairman. I appreciate it. And I say this all the time, I miss seeing everybody. This isn't, I like seeing you here, but I realize that I honest to goodness like people. And so not seeing everyone is really tough for me. A couple things happened in Virginia. The governor has made decisions about when the Commonwealth should open and should not open. And on Mother's Day weekend, we actually had our 5 health directors in Northern Virginia, which is Arlington, Alexandria, Prince William, Fairfax, and Loudoun, and all the towns and cities encompassed within, looked at their numbers and realized that Loudoun County, our numbers were, Northern Virginia numbers were tracking with the metro region, so tracking with Washington, D.C. numbers and Montgomery County, Maryland numbers, and we weren't meeting the criteria that would allow us to open. There were 5 criteria that should allow us to move to phase 1, and we had not reached any of them. So the state health directors met on a Saturday morning, the next at 9:30 at 11:30 that same morning, the county executives met and the city administrators from Alexandria, and then at 2:30 that afternoon, the chief elected officials from all those 5 jurisdictions met, and we realized we weren't going to be able to open, and we sent the governor a letter detailing that and why. And so Northern Virginia is about 2 weeks lag behind the rest of Virginia. Many of us got a lot of feedback about that decision. Some of the feedback was they weren't very pleased that there had been protests and things like that, and that's okay because people have to say what they believe is right, and so that's been going on. Luckily, when we kept looking at those criteria, we realized that it was a good decision because keeping us in phase 1 or phase 0 longer allowed us to get our numbers down and really, really flatten that curve, which of course is the goal, to flatten the curve. And so Northern Virginia will move to phase 2 on Friday. And that is just fantastic. We also, the same 5, wrote a letter to the governor asking that. For phase 2, what that means for Northern Virginia is restaurants can open with 50% capacity indoors and of course also be outdoors. Fitness centers can open with 30% capacity indoors, cleaning the equipment on a regular basis, hopefully every hour. Recreation and entertainment without shared equipment can open. Swimming pools can expand their operations to indoors and outdoors. Unfortunately, religious services are still at 50% capacity, so that doesn't change very much. I will tell you that on the dais for Loudoun County in phase 2, I'm asking all the supervisors to come back and be back on the dais with mask on. Those that do not want to be on the dais can join us virtually, but we will not be socially distancing in the room. We'll be either on the dais or in the room. It's also important to note that one of the reasons, or the main reason we made that decision regionally, is because in Northern Virginia, it is just like all of the rest of the COG region. It's very interconnected. So you might work in Loudoun, but live in Fairfax and go to school in Alexandria. And so as we were making those decisions, we were not making them as separate counties. We were making them as a regional jurisdiction. On that first meeting that was the May 9th letter that went to the governor, Alexandria, Arlington, and Prince William counties hospitals were fairly close to capacity. And what we knew was that if we opened the region, we would overwhelm the other 2 hospitals that sat in Fairfax and Loudoun. So the hospital systems, Nova Hospital System, the HCA hospital system, both said that they did not feel like the region was ready to move to phase 1, even if some independent jurisdictions are. It's also important to note, and I don't know if everybody knows this, that the PPE equipment cleaner that sits in our area, and that's for the entire COG region, sits in Washington, D.C. And that decision was made. It was a federal government decision of where that equipment should sit. So when we make these decisions, it is, I understand that different counties or towns or cities may get upset if their numbers look like we're not being overwhelmed. But when you look at it jurisdictionally, we know that it's a jurisdictional discussion and a jurisdictional decision. So that's why we've done those. I talked to my 4 counterparts, my 4 chief elected officials in Alexandria, Arlington, Prince William, and Fairfax on a regular basis, almost a daily basis. I talk to one or all of them via email or text conversations or chats. And so we go back and forth about how things look on the dais. How are we going to talk about our health metrics? And so we have just incredibly good communication and relationships. And in fact, when I had the protest outside of my office, I actually called some of those same colleagues to just kind of lament, how tough that was. And so I really do appreciate that regional organization. I appreciate NVRC, the Northern Virginia Regional Commission, and I appreciate COG and all the bodies that do regional planning and have dealt with this issue from a regional perspective. So after Mark talks, I'll be able to, and happy to answer questions.
Thank you, Chair Randall. Just checking to see if the county executive has been able to join us. Checking, don't see.
You mean Loudoun's county executive?
Our from Mark.
Mark, oh, okay.
Executive Elrich. So Chuck, I don't see, I'm checking over to see if.
I think we told the county executive to expect about a 1:15 arrival, so I think.
Hey. Okay, I'm gonna let you go. Okay.
I think we got him.
I have material.
Feels like Star Trek there, Mr. Executive. I spoke up, and the next thing I know, the particles, they started to spread, and there you were.
It's a very bad episode of Star Trek. I keep telling people, this is like the 4th different kind of portal.
Yes.
I'm like, could we please one portal to rule them all? Just one.
WebEx. I just left Zoom. I'm on my way to the meeting. So welcome to 2020.
Hallelujah. How's it going?
It's your floor. We're talking reopening.
So let me find I had a couple of notes I wanted to use for this. Okay. Pull stuff right up. Has anybody talked yet already?
We heard from Chair Randall from Fairfax, from Loudoun.
Kidding? Are you kidding? Fairfax? Were you kidding?
From Loudoun.
We're from the best county in the country over here. What are you talking about?
Let me stop before somebody begins to talk about annexation or something. They may take that as me sublimely stating that you're going to annex
willing
them.
to annex Fairfax if they wanted. That's fine with us.
Dangerous mistake.
We're friends, but not that good.
Phyllis, the cat's out the bag. Sorry about that.
I don't even have a common border that I can use as an excuse.
That's right. You watch yourself, Mark. You watch yourself.
I don't need to annex anything. I got enough issues going on. So just talking a little bit about, how we dealt with it and what we're dealing with.
Yes.
Sure. So, I think, frankly, to start with, the failure of the federal government to follow up on any things they were told about pandemics and what they ought to be preparing for, put this entire country into, I think, a fairly horrible position. No vaccine, no knowledge of the disease. And then it just kind of gets worse from there. So when we got our first cases, I think we were the first ones in the DC area, and we had 3 cases from people who came back from a river cruise that took them up the Nile. And the guidance from the CDC was the only people you should test are people who've traveled to foreign countries. That proved to be a bad idea. And cases, got spread around probably pretty quickly. And with air travel and people coming from other parts of the country and other parts of the world, and then circulating without symptoms, it's, you don't know who has it, and so you don't know who's spreading it, and that's been a real problem, for everybody. The next iteration, after that, is you only test symptomatic people, and so now we know that people spread COVID asymptomatically, and who has walked back their ridiculous statement the day before yesterday, and Dr. Fauci put a punctuation point on the fact that it was ridiculous, and that in fact asymptomatic spread is a real thing. And we were only testing people who are symptomatic, which meant that you're not testing everybody who's potentially spreading the disease. And then you hit the third thing when it dawns on them, you need to test everybody who's symptomatic or not symptomatic, but we don't have the test kits. And, the governor on the one hand went out and got test kits, but he got test kits without reagents and swabs. I know because I personally tried to get the county to buy test kits, and we ran into similar issues. I couldn't get the whole package. I could get part of the package, and or I couldn't get the testing machines here. There was no capacity. A lot of stuff could go wrong. But our whole policies were not based on best practices. They were based on limited supply. And so we've been doing contact tracing, but for the longest time, in fact, until the last week or so, contact tracing meant if you knew who contacted a person with the virus, you told them to go sequester for 14 days. Well, maybe they did, maybe they didn't. And maybe they spread it to their family in the process of sequestering, and their family is going out into the world. And that wasn't based on best policy. That was based on the limited availability of test kits. I don't blame people, but it's a perfect example of what happens when you don't have adequate supply and you try to make rational decisions about how are you going to ration the use of these kits. And you wind up having, making really difficult decisions, like Sophie's choice type decisions, like you're going to get the test and I'm not going to test you. Now that where we are today is where we should have been in the beginning, which is we've got the test kits. I've got a contract for 20,000 test kits for a week for the next year. So we are going to test like crazy, and we're going to be able to do repeat testing. And, some people need to be tested on a weekly basis or biweekly or semi-weekly basis. We're going to keep doing this. And that's where it should have been. And if we had done that, your contact tracing, I would have identified the contacts. I would have tested all the contacts. I would have found who was positive, probably in an early stage. I would have then tested all of their contacts, and we could have gotten a handle on this and reined it in much earlier. But you need to have the tools to do it, and we didn't have the tools, and I don't blame anybody other than the president for not letting us get adequately prepared and heeding the warnings of people who said this is going to be bad. So we know it's bad now. I think we've done a lot mitigate it. And that's one of the lessons. One lesson I've learned is how hard it was to buy PPE. And everybody was struggling to get PPE. So we have bought so much PPE in Montgomery County that we've opened the store to sell it to small businesses, so they can come to us and buy PPE. I've got over 2 million N95 masks. I've got another million of regular masks. I've got tens of thousands of gowns. We've been supplying hospitals and nursing homes when they need it. And I've told my folks who initially we were talking about, we're going to get a supply for the next 2 weeks. And I said, no, buy for the next year. I said, we need to have this, and what we don't use now, I want you to keep buying, because when this comes back, and everybody's pretty sure it's coming back, I am not going shopping in the middle of the pandemic when the prices are exorbitant. We're being extorted by people who the cost has nothing to do with the price of production and has everything to do with scarcity. You would think in a time of national disaster where people are dying that people selling stuff wouldn't be using the scarcity principle, but would be using the humanity principle. But apparently humanity eludes some people still. I'm not saying don't make a profit, but the idea that people are paying 10 times, like I could buy gowns for $9 a gown, and I asked the hospitals what they paid for gowns. Previously, it was like $1 a gown. So my folks have got supplies. We are continuing to stockpile stuff. We're going to be better prepared. The last thing is the economic impact. And, it's been really, really hard. And I don't have to live it other than a manager of resources. Our folks are employed. We've been able to keep people on admin leave. We learned a lot about teleworking. We're like, I think 70-something% of our workforce, leaving out, the police and fire and people who have to be frontline, are teleworking. And even as we went into it, we had managers saying, no, we can't telework. And it was like, we are not sending everybody home on admin leave to do nothing. Figure out how much of this we can telework. And it's been eye-opening to people. And people, there's an upside to this. People worry about productivity. And I said, we need to have productivity measures. But the difference between this and regular work is you could get your job in the office done in 6 hours, and then you got to sit there 8, right? Because you're measured by how many hours you worked. When you're home working, if you finish your job in 6 hours, you've done everything we asked you to do and your job's done. Your job is actually done. You don't have to sit there. And so I think in some way it encourages people to work more efficiently.
Yeah.
There's a reward for working more efficiently. But in general, though, we're going to struggle with revenue declines. We have, we know income taxes will go down next year. We don't see it so much in this year's income tax because that was based on incomes that ended December 31st, 2019. Incomes at the end of 2020 are going to be lower. That's going to affect us deeply next year. Property taxes are going to be lower than we estimated. And unfortunately, I've got a property tax system which is unlike anybody else's property tax system in this region. It was implemented wrong. It violates the actual law, and it's been done for 30 years, and it's absolutely been a disaster for the county. It has cost us millions of dollars every year, and we're trying to fix it. Some people don't want to fix it, I guess. But it's a problem that we're facing that's going to be unique to everybody else. Because my next year's tax revenues are based on this year's tax revenues that I actually receive multiplied by inflation. So imagine declining property tax revenues come December, and my inflation multiplier is 0.
Mark, I think we share we share that lament. It's not exactly the same, but we share a similar lament. Let me ask you a quick question. With regard to phase 2 opening, how are you going about that decision-making process, and where are you with regard to the concept of phase 2?
So we put out today, we did a tweet about an hour ago now that shows hypothetical phase 2 and phase 3. And since the governor refuses to share anything with us in advance, we get these calls with his staff and then they don't tell us anything. We've anticipated some of the things we think the governor may do this week or next week. And so they've got asterisks. For example, we may allow indoor retail at a certain level if that's what he allows. We may allow gatherings of 50 if he goes up to 50, but we acknowledge that we think these changes are likely coming and we're comfortable with that. We've got provisions for reopening indoor restaurants at 50% or one patron per 200 feet. We're trying to work between that. Indoor retail, same thing, either 50%, probably one patron per 200 feet, because 50% is probably too much for a first stage. We're going to allow some indoor house of worship services, but we remind people that the studies all over the country list worship services as one of the high-risk events, a higher risk event than a restaurant or opening retail, because it's a social thing. And how do you stop people who are mourning from hugging each other?
Right.
It's just human instinct. And now you're asking people to overcome human instinct. And so this going to be challenging. We're hoping the governor does more with childcare, because you can't bring a workforce back to work if you don't have more childcare. We're looking at a program to put another $10 million into childcare. We've done $20 million in business assistance so far. We anticipate doing more of that. So that's what phase 2 kind of looks like. Lap swimming in pools. We've probably gotten more calls about this than anything. So we're going to allow lap swimming. But I note the governor's only allowed lap swimming and doesn't allow general pool use and doesn't allow wading pools or any of these other things, because that's about playing with each other in contact, and that's not going to happen.
Right. So, Mark, thank you for that. Let me, I had a couple of questions that did come in from board members. I'm going to try to ask, and before I ask, I'm just going to say that, we as a council in Prince George's received from our county executive a proposal, resolution to extend our state of emergency because by state law, the governing body, which is the county executive and the county together, have to extend emergency. But we also expect a phase 2 reintegration to come sometime in the near future, if not tomorrow, probably by Friday, where our county executive will announce the different things that we attempted to agree upon. One of the features that we talked about, and we weren't quite equipped in Prince George's County, was outdoor dining. Specifically, we had to look at that and fashion some ways forward with regard to outdoor dining. And as we talked about it in our budget, we know that the impacts of COVID won't really be seen until the revenue realities of next year. And so we expect, our budget to also be, significantly different, although this year we were still about $100+ million light from the perspective of revenue, and had to have an alternative budget that we were able to approve a couple of weeks back. And with that, though, I think Ms. Gross had a question about the percentage of Montgomery County's budget that comes from income taxes. And her comment was Virginia jurisdictions do not have access to income taxes, I believe. Real estate taxes are their primary source of revenue.
So I don't have that number in front of me, but obviously income taxes are a much greater portion of our income. The Montgomery County produces something like 90% of the state's capital gains tax. Right. This is, on a sidebar, there is some relief to us on this because, a couple of years ago, we had a huge hit on capital gains that cost us $60 million in taxes. Apparently, the stock market is having a jolly good time.
Yeah.
The NASDAQ hit, back to record highs, and the Dow is recovering. So we may not take that hit. And I'm hoping that the unemployment, because unemployment was so much larger and it's taxable, actually, we're not going to get the same hit as we got during the last Great Recession, where there was no adjustment for people. So we may be a little bit less hard hit than we first thought. I think, the state reduced its original estimates for us, losses for all of us, by, I think, more than 50%.
Right.
So if things continue and if we can get this country reopened and we can get the government, I think the biggest problem is dealing with mortgage default, rent defaults, mortgage defaults, on both, and rent defaults on both individuals and on commercial property.
Right.
If they would fix that, doors would reopen. If people are afraid that they're going to be done for the last 3 months' rent in the commercial world, they're never going to reopen. So this is a choice we've got to make. No one ever fought a war and saying, well, gee, I wonder how we're going to pay this back. You just fought the war because you knew you had to win the war. And you wanted to be better when you got out of it. And we need that approach here. We don't have it yet.
If the way we've approached the things that you described, and just from the perspective of better coordination, something that you mentioned with regard to PPE and your ability to buy in bulk, I'm just hoping that from the regional perspective, we're taking heeding the warning that, you know, federally we need to be equipped and ready, that when the Fed does not act and respond, that we in this region, we have the ability, the capacity, the propensity to respond. So, you know, if PPE, we need to be able to figure out how to make sure regionally we're taking advantage of that. It sounded like Ms. Chair Randall. Let Randall jump back in.
Mr. Chairman, two things. One, so Loudoun County is the county in the entire COG jurisdiction that does our budget first. So our budget starts literally the first meeting in January. We're on the dais. And so we had actually just finished our budget when COVID really struck. And to respond to that, we froze $100 million of our budget. We put it in reserve. And we also pushed back the date that our personal property taxes would be due. That date was pushed to June 5th. We have now start receiving personal property taxes revenue, and we are down only about not quite 2% of where we normally would be. What we believe is the second iteration of taxes that come in October, we may see the bigger hit. Then right now the taxes are coming in pretty much as expected, but later on when people really take stock of what has happened with their numbers, then we may see a larger hit. On the PPE and purchasing, it's been really interesting because in the Northern Virginia region, we did pull up all our efforts together to buy PPE. Loudoun was actually buying 30,000 units, but the entire PPE purchase was more than 200,000 units. And when we did that, it kind of flagged the feds that there was a very large purchase coming in. They met that purchase at Dulles Airport and rerouted it away from the localities. And so we are now trying to decide, is it better to do it just as a locality, which actually will cost us more, or do it as a jurisdiction? Because we do not believe it would have been flagged and rerouted were the purchase not have been so large, which actually kind of got the Fed's attention. And I'm not saying they rerouted it and while it was coming in, they literally met it at Dulles Airport. It literally had arrived and they rerouted it from Dulles Airport. So what we hope is that all PPE production across the board, federal, state, local levels, has been improved, and so that won't happen again. It is obviously much more cost efficient and cost effective to order that much PPE as a region and not as a locality. So thank you.
So the feds reimburse you for stealing your stuff?
That was going to be my question, Mark.
No, we were going to pay for it upon its arrival. And so upon its arrival, that they rerouted. Now, the truth is, the FEMA is supposed to do what's best for the country. I'm supposed to do what's best for my county. And so they were doing what was best for the country because at that moment, New York was just being decimated. And so they rerouted it, we believe, to New York, which truthfully, they were doing what they're supposed to do, as were we. But it's just the lesson we learned is possibly in the very middle of the emergency to do things as a region may not have been as effective as we had wished because it got the attention.
Gotcha. Great input. Let me turn to council member from Montgomery County, Navarro. She had a comment.
Yeah, thank you so much, Mr. Chairman. I did.
You're breaking up.
Nancy, is for some reason you're forgetting every other word, T.
It says you have low bandwidth.
So let's let Nancy try to go in and come back, go out and come back in. Maybe she can get that question in. I'm looking on our chat, Chuck. I don't see any other chat question. Nancy, are you there?
Yeah, I'm here. Can you hear me?
Yeah, try it again, Nancy. We lost you the first time.
Oh, okay. So I just wanted to share that the county council received, of course, the budget request from the executive on March, in the second week of March. We had to very quickly figure out how to address our budget framework because we're in the middle of the COVID-19 emergency. We made a decision to adopt a continuity of operations framework for our budget that basically included funding our school system and the college on a maintenance of effort level. It also included not adopting any salary increases, but waiting to see what the picture looks like in the fall, hopefully. I just wanted to share that because obviously different jurisdictions, because they have different timeframes for their budget, had to make different decisions. But this is how we approached our budget process, and we focused on additions that are related to COVID-19, especially those that can be reimbursed by the CARES Act. So that's how we approached our budget in Green County, and it is my hope that we get a better sense in the fall. But it is very much up in the air because there's just so many factors that obviously will contribute to understanding what our fiscal picture will be going forward.
Thank you, colleague. And I'll just piggyback. We had to take a very similar approach from that perspective, and actually we had to dip into rainy funds in order to shore up our balanced budget. We also delayed and canceled cost of livings and all of the merit increases for staff in order to balance our budget as well. And we had just received all of the nicely printed new documents on like March 11th, I believe it was. And the next thing you know, the whole world was different. So, lessons learned with regard to that. And I think we're having the same experience from the perspective of as we have shut things down, how we reopen things here in the region. And what we do know is that as we walk in this lockstep, as we work together, it's far better for everyone. We've encouraged everyone, regardless, to remember that when they are interacting, social distancing is the new rule. That masks matter. Masks are a must, and so we must continue as leaders to model that type of behavior because the pandemic hasn't gone anywhere. There's no vaccine yet. There's conversation about the possibility of such. That hasn't occurred. So we have to be very careful. We have to be very coordinated and conscious as we go through reopening as a region. Let me do this. And as I stated that, I was just trying to read if I saw any questions in the chat gallery. I see none. So let me ask, are there additional questions from board members or comments from board members in Maryland?
Hey, Daryl, can I add something to this?
Yes, please.
First of all, I wanted to say I really appreciate working with Prince George's County. I mean, our health officer has worked really carefully with you and with the District of Columbia. And we keep pointing out to people that our three jurisdictions are not like the rest of the state of Maryland or the rest of Virginia. And we have to be extra careful. So we've tried to coordinate. I've tried not to get ahead of you because I don't want to put political pressure on somebody, to feel like if you're not the last, it's the race to not be the last to open. We all got to make the same rational decision about opening. And, so we haven't announced the date. I know you guys have a tentative. DC's tentative is a little bit later than your tentative. Yeah. But we put out what our guidelines will look like, and you should be able to look at them. And I know that Travis really appreciates working with your people. I really do too. And on a separate note, we were the first county that froze everything. We froze all procurement, all procurement except for necessary procurement, and all hiring 2 weeks before the state froze it, because we were trying to preserve everything we could preserve for the rest of the year and into next year. We're pretty well situated on reserves. If all I had to worry about was this year, my reserves would more than cover it. But my reserves have to cover this year and next year, and that's what we're waiting to find out.
That's right.
I just want to appreciate, the work that you and that Angela, along with Mayor Bowser, have been able to do to keep us from making bad decisions. It's
Absolutely.
a collective effort.
Mark, absolutely. I appreciate that. And I know that we feel the same exact sentiment, jurisdiction as partners, as regional partners here in the BB. We're all proud of how we've coordinated to deal with this pandemic. Very proud. And so we appreciate you as well. I wish my rainy day fund and my reserves were as flush as other jurisdictions, but we'll keep working once this is over from an economic development perspective to secure that and make things even better for tomorrow for all of our citizens. Thanks again. So let me check to just see if there are any other questions from Virginia, or maybe a final comment from Chair Randall. Any final thought, Chair Randall?
My only final thought is that, I think this was a really good question because, as I said before, not just Northern Virginia, but the entire region is a very, very interconnected region. And so what one jurisdiction or one area really does impact one another. And so when I say we're all in this together, it does not mean that we're all impacted or infected in the same way, because as we've talked about earlier in this conversation, we're not all impacted or affected in the same way, but we all can look for the solutions at the same time. And what we do impacts for the good or for ill one another. I heard someone say, we're going to sink or swim together, and we are determined to swim, and we're determined to rise. And that is how I feel about my county, my region, and in fact, the entire COG jurisdiction. So thank you very much.
Thank you. Let me turn to Chair Wheeler and President Collins for comments.
Did you say Chair Wheeler?
I did. I think you may have texted in a comment that I'm just seeing.
I didn't, but that's was there another Wheeler on? Just in terms of going on to phase 2, we're excited. We're trying to coordinate with the rest of the region. I love to hear what other people are doing because it tends to lend itself to best practices. We've struggled with testing, but we're actually doing really well with testing right now. And I love the idea that someone was getting 20,000 test kits a week to test their way out from Montgomery County. Didn't put a comment in the chat box, but I am listening. So with that, I will pass.
Thank you, Chair Will. How about President Collins?
Yeah, and thank you again for the moment. And, I want to reiterate how much I appreciate the dialogue because Charles County is smaller than many of the jurisdictions. When you look at the actual, metrics and measures that are in place, the numbers may not look as bad, but we recognize that we are a part of the metropolitan region. And so we respect and we make decisions based on us being affiliates and a part of the region. And so, I take advantage of this opportunity to hear directly from all of our partners that are part of COG, just in terms of trying to balance the discussion, because it's no different than any other jurisdiction in the entire nation. There's a very specific argument to reopen everything, but at the same time, our responsibilities are based on the health, safety, and welfare of all of our citizens. And for me, that's what drives the way I'm looking at all of this. because at the end of the day, even the experts, have been not necessarily consistent in how they're looking at how this pandemic will impact us overall. And so, for me, I am listening intently, to you. I'm receiving guidance from all of my partners as part of COG. I want you to understand that, yes, all of us want to see our economies move forward, but at the end of the day, we are responsible for our citizens. And that's all it is to it. And, that's kind of where I am, but, but thank all of you, and I appreciate this dialogue. Thank you very much.
Thank you very much, Ms. Collins. Let me turn quickly to Supervisor Bailey. Supervisor Bailey, I think that was you that was in the chat room, Andrea Bailey.
No problem, Mr. Chairman. Thank you very much. I just wanted to echo everything that's been said, especially what Mr. Collins just said previously. My thought was we were caught off guard with all of this, of course, but are we capturing somewhere in a strategic plan or in an immediate book, something, it's not going to be a roadmap kind of thing, but I think we reacted immediately from a regional standpoint in a very positive and holistic way. And so we need to have something ready. Hopefully it doesn't come again, but in case it does, I think that that would be necessary.
Supervisor Bailey, yes. And from our perspective in COGS as a planning entity, we are definitely in the process of grabbing best practices and making sure that as we move forward, those best practices become part of our regional response to things like this pandemic. If you look back at 9/11, COG was at the forefront of working together with the region, bringing them together. One of the committees befell the work. And so I expect fully that our approach to it will continue to be that type of approach. Let me turn to, wait a minute, let me just make sure in my chat room before I say what I'm about to say. That was the last person I had signed up in the chat room. Let me turn quickly to my co-chairs, my two vice chairs. First, just to see if Mr. Dorsey had any comments that he'd like to add to this lexicon, and then to Mr. White. Mr. Dorsey?
No, thank you, Mr. Chair. I'm good.
Good to go. How about you, Mr. White?
I'll only say what is echoing what I have said. We're all trying to figure out an impossible balance right now between our economies and the health and safety of the residents that we were represented to protect and keep safe. And so we're all trying to figure it out as we go. But I do think that the last comment of really figuring out in an after action way, what we were ready for, what we could be ready for better next time around, because it's not a question of if this will happen again, only a question of when. I do think we're still in the middle of it right now, so I don't know that we could figure this out right now. But as we sort through this, if we really start to come together and think through for the benefit of the future, what we need in place as a minimum level, as a baseline, what we need in place to protect ourselves, protect our residents, and protect our economies in the future, I think that would be incredibly helpful.
Perfect. Thank you, colleagues. So let me thank our colleague as well, Chairman Randall, as well as County Executive Elrich for participating. We
pleasure.
Thank you.
Thank you.
And we know that this regional work is work that we all have committed ourselves to, as we have committed ourselves to the work of making sure that the health, safety, and welfare of our constituents that elected us is well maintained, as brought to bear by Mr. Cox. We know the complexities of coordinating in our multi-jurisdictional region, and I think the close alignment of our reopenings is a testament to our partnership. As we continue on the reopening path and continue combating this virus, let's keep this commitment to coordination going, because it really has been beneficial throughout these challenging times. I appreciate everyone's attention. We were concerned originally that we were going to have a meeting that might have escaped the boundaries of our 2 hours, but I am apprising you of, at this point, if we have no other business before the body, and I'm checking with Mr. Bean just to make sure we've crossed all T's and dotted all I's.
Yes, sir. We'll take up the issues that were raised with the city and county managers. I know Mr. Klein, Mr. Riddick are on the line. Emergency Managers Committee, under their purview, is PPE and looking after action, and also some of the issues related to the health officers. We are glad to have the chair of the Health Officers Committee, Dr. Gales, with us today. Thank you.
Perfect. So if all hearts and minds are, I hear someone attempting.
Senator Barker.
Hey, Senator Barker, let me give my favorite senator the last word.
All right, just a quick comment, just to prove that the efforts that have been made in the metropolitan area in terms of delaying opening and moving too quickly on things for about 2 months. Northern Virginia, which has less than 30% of the state's population, had about 70% of the cases. Since the rest of the state opened up and we didn't, we now have less than 50% of the cases. We were doing over 500 people per day diagnosed with COVID-19. This morning, we had 131 people.
Wow.
The smallest in 2 months, and way below the rest of the state. We actually had less than our share of the population. So we have really turned the corner here in Northern Virginia, and working with the people in DC and Maryland has been great.
So thank you, Senator Barker. Just another testament to how regional collaboration is working for Maryland, Virginia, and the District of Columbia. All right, so thank everyone for joining us and participating in our virtual meeting. The next COG Board meeting is scheduled for Wednesday, July 8th, 2020. I'm expecting it likely will be a virtual meeting again, but you know, we won't announce that until the appropriate time. We try to be prudent with regard to all things that are necessary to consider. So stay in touch. We'll stay in touch with the details and logistics for that meeting. Is there a motion to adjourn?
So moved.
Any nays? I'll take that as we're all ready to go.
Thank you.
Thank you all.